Hi, my name is Megan Fitzsimons. I work at Rushford as a prevention professional under the MORE grant, which stands for Meriden Opioid Referral for Recovery. During the COVID-19 pandemic, we are starting a Q&A video series asking the public to submit questions based on substance abuse, mental health, addiction, treatment, and recovery during the COVID-19 pandemic. The first question we received are treatment centers and hotlines still available and open? Yes, they are still open and available at this time. While each agency has a different protocol and operating procedures for COVID-19, most are still open and offering services to new patients. Rushford is currently offering all services to new patients across our various locations. To access treatment at Rushford, call our admission center at 1-877-577-3233. You'll conduct a brief phone screening with a trained professional who will assist you in accessing the care you need. For adult or adolescent mental health or substance use outpatient services such as PHP, IOP, OP, medication management, and medication-assisted treatment, in-person assessments will be scheduled. Assessments are being conducted in person following strict safety precautions for COVID-19. After your assessment, you will arrange with your assessing clinician for telehealth and Zoom appointments. Rushford is accepting new patients for our withdrawal management services at our men's and women's inpatient treatment program located at our Middletown location. Other available resources are the statewide DEMAS Access line at 1-800-563-4086, which is a 24/7 access line assisting people in locating addiction services treatment. The Access line will help you triage and find available withdrawal management and inpatient programs. You can also find up-to-date information for addiction services by Googling Connecticut Addiction Services or going directly to ctaddictionservices.com. Here you will find bed availability for detox programs, residential treatment programs, recovery houses, and sober houses. For psychiatric emergencies, mobile crisis teams are still available 24/7. Rushford's 24-hour mobile crisis can be contacted at 203-630-5305. You can also contact mobile crisis by calling 211. The Suicide Prevention Lifeline can be reached at 1-800-273-8255, and the 24-hour crisis text line can be reached by texting hello, talk, help, or start to 741-741. Hartford Healthcare also has a warm line offering phone support at 1-888-984-2408. You can also access 24-hour domestic violence services by calling 1-888-774-2900 for English or 1-844-831-9200 for Spanish. You can access online 12-step recovery meetings by going to www.intheroom.com or at www.smartrecovery.org. The next question we received is, I have noticed that my child might be using drugs. What do I do? The Partnership for Drug-Free Kids is a great place to start. They have set up specific services to parents and caregivers who are worried about a young person's substance use. For detailed information, visit their website at drugfree.org. One option they have is the new COVID text line. Text COVID to 55753. This resource is for parents and caregivers who are concerned about their child or loved one's substance use. Enroll in the text-based COVID support program to receive regular messages on how to help yourself and your loved one during these changing times. You'll receive messages on how to communicate effectively, how to deal with a family member risking exposure to COVID-19, how to model healthy coping behaviors, and more. Additional support is available in English and Spanish from 9 a.m. to midnight Eastern Time weekdays and noon to 5 p.m. Eastern Time weekends. Connect through text, email, or call. They also have an online support community now available. In response to the uncertainty and circumstances surrounding COVID-19, they're hosting a series of free supportive online gatherings for parents and caregivers designed to help you connect with others and gain helpful insight and ideas. The next question is, what is the admissions process like if I were to request treatment at Rushford? Rushford has a centralized admissions department. We ask individuals to reach out to our 877-577-3233 number for assistance to access care. The hours of operation are Monday through Friday, 8 a.m. to 6 p.m., Saturday, Sunday, and holidays from 8 a.m. to 2 p.m. Our admission specialist will conduct a screen to assess the most appropriate level of care based on detailed information gathered during the screen. An appointment for a clinical assessment will be scheduled prior to admissions. Our residential services also include a medical assessment. We offer in-person assessments, and if meeting admission criteria, clients will be admitted to the correct residential level of care as beds become available. Telehealth options are available for ambulatory services for all of our locations. The exception is Meriden Adolescent, where the preference is an in-person assessment. We will accommodate telehealth options if that is requested. Most of our ambulatory treatment programs are operating during this pandemic via telehealth and will be explained during the assessment with the clinician. The next question is, what safety precautions are being done at Rushford if I were to need to come in for treatment? We screen all individuals requesting services for symptoms, including cough, fever, flu-like symptoms, prior to providing an appointment. Any individual positive for any of these symptoms will be referred to their primary care provider. As stated before, we screen all individuals, employees, and consumers for symptoms, which includes a temperature check prior to entering our facilities. Any individual with a temperature or symptoms will be referred to their primary care provider and not allowed to proceed in the building. Resources are provided if needed. All persons in our building are wearing face masks for the safety of all individuals. Employees are practicing social distancing and effective hand hygiene. Our facilities are contracted for appropriate daily cleaning as well. The next question is, are detox facilities still open? And if so, who do I call? Yes, detox services are still available. For Rushford Withdrawal Management, please call our Rushford Admission Center at 1-877-577-3233. Other available resources are the statewide DMS access line at 1-800-563-4086, which is a 24/7 access line assisting people in locating addiction services treatment. The access line will help triage and find available withdrawal management and inpatient programs. You can also find up-to-date information for addiction services online by Googling Connecticut addiction services or going directly to ctaddictionservices.com. Here you will find the bed availability for detox programs, residential treatment programs, recovery houses, and sober houses. You can call 211 for additional information and resources. The last question is, I'm homeless and have nowhere to go. What resources are available to me? If you are homeless and have nowhere to go, please call 211 for resources. 211 is a 24-hour information line operated by United Way in Connecticut, which can assist with housing resources. 211 staff will screen for emergency housing resources such as homeless shelters, homeless drop-in centers, domestic violence centers, runaway youth shelters, and transitional housing shelters. You can access 211 online by going 211ct.org. Thank you for tuning in to our Q&A video series. We will be releasing a new video each week based on the questions we receive from the public. If you have any questions regarding mental health, substance use, DeMoor program, treatment, or recovery during COVID-19 pandemic, please reach out to us on Facebook at the Meriden Health Youth Coalition, on Instagram at Rushford_prevention, or you can email me directly at megan.fitzsimons@hhchealth.org. Thank you and be safe.